It's my pleasure to introduce Dr. Yuanyu Xie, a research associate in my group for the past 4 years. She obtained her PhD from the Department of Earth Sciences at Tsinghua University, and prior to coming to C-PREE was a postdoc at the NOAA Geophysical Fluid Dynamics Lab just down the road from 2018 to 2021. For those of you who don't know, GFDL is one of the key climate modeling labs in the United States. At Tsinghua, she began her research examining the sources of fine particulate air pollution with a primary focus in China. And at GFDL, her focus turned to the effect of wildfires on extreme air pollution events in the US. Combining data analysis and modeling, she forecasts that Western US fine particle air pollution is likely to triple due to climate warming. And this work, following her publications, received substantial media attention. In my group at C-PREE, she's continued work on wildfires, now extending her research to include the effects of increasing wildfire smoke on public health. In addition, she's analyzed air pollution in India and the impact of both emission controls and changing meteorology on surface concentrations of fine particles. And this is within the context of the National Clean Air Plan that the Indian government has put in place in an effort to try and address its extremely terrible air pollution problems. And some of the conclusions are that the clear decrease that we can see from the Central Pollution Air Board's measurements are partly due to emission reductions, but also largely due to changes in meteorology, which lets the air pollution mix more. This past summer, mentoring 2 High Meadows Environmental Institute undergrads, she helped build a web-based interface to allow policymakers to visualize results for research on both wildfire smoke in the US and on air pollution trends in India. Her work's been published in top journals and has benefited from widespread collaborations with Princeton, in Europe, India, and China. Please join me in welcoming Dr. Xie, and we look forward to hearing about your work on emerging challenges in meeting health-driven air quality standards in the US and India.
Thank you so much, Denise, for the generous introduction, and good afternoon, everyone. I'm thrilled to be here to share my research on air pollution conducted here at C-PREE and in previous year during my postdoc at the GFDL. And I would like to start with this photo of a major pollution event that happened in January 2013, just when I started my grad school at Tsinghua University. And you can see the dense smoke and the unpleasant smell. The urgency everyone felt that we need to understand and reduce this pollution is what really drove my research direction into the air pollution. And when you look at this hazy sky, this is because of the presence of abundant fine particulate matter, which has a diameter of less than 2.5 micrometer, less than 1/25 of a human hair, that are especially efficient in scattering sunlight. And in addition to affecting visibility, these particles also affect cloud formation and rainfall processes, and affect the energy production efficiency through intercepting sunlight or depositing on panels. That has profound impact on water cycle, ecosystem, and the stability of our energy system with the increasing share of renewables. Of course, one major concern of these particles is the health side, where because of their small size, they can penetrate deep into the lungs and even enter a bloodstream that have major impact on cardiovascular and respiratory diseases. Recent studies also find an increasing linkage between exposure to air pollution with mental health outcome, including declining cognitive as well as depression. According to a recent State of Global Air report, air pollution was the second largest risk factor of global death in 2021 and caused over 8.1 million premature mortalities. Of those burden, about 60% are coming from exposure to ambient PM 2.5 alone. Because of these severe health consequences, the World Health Organization set in 2005 an air quality guidelines to limit this pollutant concentration with an annual standard of 10 microgram per cubic meter and 25 for daily concentration. And with increasing evidence of the harmful effect of this particle at lower concentration, in 2021, the World Health Organization tightened the air quality guideline and cut the previous standard by half to 5 and 15. So a question, how many of the world's countries do you think that meet the World Health Organization annual guideline of 5 microgram per cubic meter? You might make a better guess by looking at this World PM 2.5 air quality map in last year, where these dots represent PM 2.5, annual PM 2.5 concentration based on over 40,000 station or low-cost sensors across 138 countries. And if you see blue dots, which mark those areas that meet the standard, and there are 7 countries. As the color moves from blue to green, yellow, red, and purple, pollution level rises. And some even exceed the World Health Organization standard by over 10 times. It should be noted that these World Health Organization standards are health protection goals, but they are not legally binding standards. And instead, each country has set its own national ambient air quality standards that can legally enforce limits to reduce the pollution concentration. For example, in the US, the annual standard for PM 2.5 is 9, and in India is 40. They are all higher than the WHO standard. The differences that we see in these standards across the countries partly reflect the different phases in their environmental and economic transition. If we look at US and Europe, and over the past centuries, starting from 1960s, we clearly see the pollution increase first before industrialization with economic development, and then decrease rapidly because of cleaner technology, environmental regulation, and economic restructuring. This is consistent with the environmental Kuznets curve that's showing a grow first and clean later trajectory. And in China and India, they are on a later phase of the trajectory compared to the US and US and Europe. If the trends continue, we might expect slower but consistent improvement in air quality in US, Europe, and China, and likely declining pollution level in India after it peaks. However, rising global temperature has added a layer of complexity to this problem, as changing climate can affect local weather patterns like changing precipitation, temperature, and wind that affect how many human source pollution form and stay in the atmosphere. It also will affect Earth system processes by increasing the occurrence of drought and wildfire. Thus, that could lead to new source of pollution. In addition, in response to climate change, there might be changes in human behavior, for example, increasing cooling energy demand, and changes in agricultural burning pattern that in turn affect the anthropogenic emission trends. So my research question is to understand and identify and quantify these emerging challenges under a changing climate to how much our pollution trajectory might change because of this changing environment, and how can we design effective policy in response to these challenges. And in the next 30 minutes or so, I will focus on India and US. You can see they recede on different side of the curve, and they can kind of represent like the developed and developing countries, the similarities of challenges that they are facing. Let's start with the US. Since the 1970, the Clean Air Act was enacted, we see a dramatic decrease in air pollution. For PM 2.5, surface data collecting from over 300 sites suggests about 40% reduction since the early 2000s. And this is largely driven by the increasingly stringent air quality standards in the US that was first set in 1997. And the estimated health benefit of this stringent standard and a decreasing pollution level is about 3,000 avoided deaths per year. However, in recent years, story seems to be a little different. If you were around in summer in Princeton in the past several years, you might receive some air quality alerts from your weather app. And that's also shown on this air quality index, daily air quality index map as the orange, red, and purple spikes that you see. In particular, in June 7th, 2023, at Newark, the air quality index reached hazardous level. And this is associated with the smoke pollutant transported from Canadian fires. In fact, that day, this smoke has made record for the worst air quality day in New Jersey in the past 40 or so years. And these spikes are not random. They are linked to an increasing trend of wildfires that's partly driven by climate-induced increasing temperature and drought. If you compare this map, which shows the location of fires of a size of normal, large, and extreme, not only we find more fires, but larger and more extreme fires in the past several decades. And in more recent years, which was not covered in the above maps, here are some data. Burn area in the 2020 fire season total 8.7 million acres, which equivalent to about a third of the cumulative area since 1984. And putting 2020 and 2021 together, which is 15 million acres, they actually burned the size of as large as West Virginia. And so we are interested in learning, are these fires leaving detectable signals in long-term pollution trends and exceedance events? And what are the health and policy implications of this increasing fire? Our previous work addressed this problem by looking at surface measured PM 2.5, the black lines, and organic aerosol, which is a major component of wildfire smoke collected across the improved network the station over the western US. And not only do we see large interannual variations, but clearly an increasing trend of these pollutants. And that seems to match well with the changes in wildfire, which is shown as orange bars, some over the western US. In particular, if we look at the recent 2017 and 2018, we find that the contribution from the southwestern Canada start to emerge. And when we zoom in this one particular fire season, the 2017 summer, and what we find is that the maximum PM 2.5 from observation across half of the station in the western US exceeded US daily standard. And about 11% of the sites had recorded PM 2.5 exceeding 100 microgram per cubic meter. And from the spatial pattern, these exceedance are very consistent with where we see those abnormally large increase in fire emission. And when we run chemistry climate model simulation, but we don't have fire emission, this is what we get. The model without fires show no exceedance and pretty clean air. But when we add fire emission in the model, the results are more consistent with what we observe, and that confirms the role of fires in driving this air quality exceedance. Based on what we saw in the past events, this fire has large impact on air quality exceedance. And the next question is, what are those impacts on the new and stricter PM 2.5 standard? As we might briefly remember, in last year, the EPA updated the annual PM 2.5 standard from 12 microgram per cubic meter to 9. And the expected benefit of these new standards include 4,500 avoided premature mortality and about 46 billion economic benefits, following strong anthropogenic control in areas identified as non-attainment, defined as where their 3-year average pollution exceeded 9 microgram per cubic meter standard. However, the increasing wildfire complicate this new standard. because the EPA has this exceptional event rule where they allow the exclusion of smoke-affected days when determining compliance because they are considered beyond local control. And therefore, it becomes critical for us to accurately estimate fire smoke pollution, because if we overestimate it, that may result in that may weaken the needed anthropogenic emission control, while if we underestimate smoke pollution, that might overburden local industries to reduce their pollution. Quantifying smoke is technically challenging because surface measurement only provide total PM 2.5 concentration without distinguishing its source. Existing studies mostly rely on either surface weather station record of smoke condition, geostationary satellite images of smoke plumes, or chemistry climate model simulation of the smoke impact. However, evaluating these three methods against surface measurement of organic carbon, which we just mentioned, is a major component of wildfire smoke, we find that all these methods individually underestimate smoke concentration. And we developed a method that integrates all the three methods as well as surface measurement to provide a more robust estimate of smoke pollution across the US counties. And our method were able to identify 20% enhanced smoke detection, which lead to as much as 23 higher smoke pollution. If you look at this map, which shows the percentage contribution of smoke to total PM 2.5 pollution in the same time period, you will see that in those years, smoke has contributed between 13 to 27% of total PM 2.5 across different regions. And in some counties, the contribution even reached about 50%. This highlights the increasingly important role and contribution from smoke to surface pollution across US. Then what happens when we treat smoke as exceptional while we know that they are contributing a non-trivial part of the pollution? In this map, when you see colors, that represent regions where the 3 years pollution level exceed the new standard. And based on our smoke estimate, we find that over 90% of these counties, actually their pollution level will be below the standard if you exclude smoke. And only 17 counties, if you, as shown as the blue or light blue color on the map, are regions where anthropogenic emission itself are enough to cause the pollution level to exceed the standard. And what are the health consequences if we treat them as exceptional? We compare two cases where focusing on anthropogenic emission control, but with compliance determining either excluding smoke, which means we'll only focus on that 17 counties, compared to including smoke, which will focus on all 556 counties, and expect that these counties will meet the standard in 2032. What we find is that by excluding smoke, the health benefit has reduced by half. In addition, increasing wildfire is also contributing to enhancing mortality. And we compare two scenarios where we assume a moderate increase in fire smoke pollution by 25% and a high increase scenario by 100%. And what we find is that if smoke pollution increased by a moderate level in 2032, the resulting increase in mortality burden has outweighed what the benefit we might get from anthropogenic emission control. And these things might worsen as climate continue to change and surface temperature continue to rise, as our previous study using Earth system model simulation suggests that in future, air pollution, PM 2.5 pollution in the western US may consistently exceeding the standard across a wide range of emission scenarios, but with the high emission scenarios seeing pollution level almost triple. These are much higher than the traditional chemistry climate model that consider weather pattern, but not accounting for wildfire impacts due to climate warming. And what that means to us is over the past several years, this extreme 2017, 18, 2020 wildfire events, which used to be a once in 25 years event, in the future, they might occur every 3 to 5 years. And in fact, the recent back-to-back extreme fire events like the 2023 Canadian fires and the 2025 LA fires seems to suggest that this shift may already be underway, and our previous result may be underestimating what might really happen. To summarize, we kind of through the introduction of this work that we've done over the past several years, we see that wildfire is driving an upward trend in PM2.5 pollution and have contributed to widespread exceedance of daily and annual standard. And these increasing fires without regulatory framework explicitly consider these fire mitigation may result in slower or even reverse decades of progress of the air pollution improvement. And in addition, emerging evidence suggests enhanced health risk in the fire smoke due to the high abundance of organic particles with higher oxidative potentials. And so our ongoing work is trying to combine our improved smoke pollution estimate with the latest fire-specific health risk function to try to quantify how increasing smoke, together with decreasing non-fire smoke, reshape the health burden across the US, particularly for a vulnerable population. And now let's shift to India. This is a complete different story where you see the pollution level is very high, driven by the recent rapid economic development and population growth. In fact, over the past 7 years, India has always been on the top 5 most polluted countries list. While the air quality regulation in India has started as early as 1970s with the establishment of the Central Pollution Control Board, monitoring and regulation of PM2.5 pollution only started recently. In particular, in 2019, the Ministry of Environment, Forests and Climate Change in India launched this National Clean Air Program. This is the first ever program that specifies a pollution reduction target of 20 to 30% in 2024 compared to 2017. And over 1.2 billion has been allocated to support the city-level action plan and expansion of surface monitoring network. To understand the effectiveness of this National Clean Air Program, we try to use surface observation to check if India is on track to meet its pollution target and what are the role of climate change in affecting our understanding of this effectiveness. So we start by collecting hourly measurement across 500 stations. These are continuous monitoring stations that are recently established across India. So we apply strict quality control and validated it against the US Embassy Air Now's measurements. In addition, we also apply strict process in temporal averaging to ensure that our trend analysis are not biased due to measurement uncertainty or seasonal data gap. And with this annual PM2.5 levels derived from this continuous station, we are evaluating how pollution level has changed in these non-attainment cities. We need to note here that the non-attainment cities are determined not based on the continuous monitoring pollution data, but based on the previously manual monitoring station, which the government document itself indicate that these measurements are not that accurate because of the sampling and reporting uncertainties. So one thing that we find is that despite this huge increase in monitoring capacity over the past several years, for example, PM2.5 monitoring station increased from about 50 to over 300 in more recent years. There is a significant mismatch of the pollution monitoring and non-attainment cities, which if you look at the red dots, which represent the 131 non-attainment cities, and the black circle, which represent continuous monitoring stations with at least 1 year of pollution data. And we find that about half of these non-attainment cities that don't co-located with a monitoring station that provide at least 1 year of data. But to assess long-term trend, we need longer data. And the situation is even worse. We only have 6 non-attainment cities that had 6 consecutive years of data for us to evaluate pollution trends. This map again shows how this monitoring network has been expanding over the past several years. But starting from 2017, we only have these 6 cities to evaluate pollution trend. Good news is what we find in these 6 cities, annual PM 2.5 pollution has decreased from about 90 microgram per cubic meter to about 50, featuring a 40% decreases. And in particular, 4 out of 6 of those cities, they have their PM 2.5 pollution level reduction in 2022 that already met the National Clean Air Program target. This seems to be a good news, a great success. But before we celebrate, we need to understand how much of those is due to policy action, while others are contributed by weather conditions. To tease apart those effects, we conduct atmospheric chemistry model simulation by fixing emission at the 2017, the policy baseline level, representing a no policy scenario. So the simulated pollution changes that we get from the model actually represent what the weather changes will bring us. And what we find is that if you look at the dark green, which represent the weather driver portion of the improvement across India in annual on the left and winter on the right, we actually see that the weather changes itself contribute to 30% of the annual pollution reduction in that 6 non-attainment cities that have 6 years of data. And it contributes to about half of the winter pollution decrease, which is one of the most polluted seasons in India in these 28 non-attainment cities because we have more data in the winter season. And why do we see such a large weather influence? You might be wondering. So we further compare daily time series of PM 2.5 pollution, our per panel, with daily time series of rainfall between the baseline year 2017, the orange, and another year 2019, the blue. What we find is that the improvement in the reduction in pollution that we see mostly occur in these several episodes, which coincide with strong precipitation in the 2019. And according to local sources, actually the 2017, the policy baseline year, has been extremely dry, with the January rainfall being almost the lowest in the past 117 years. In addition, because of the lack of precipitation, this winter has also been very stagnant, which will help to track pollution at the surface level, even given the same emission level. So this implies that the National Clean Air Policy baseline year 2017 is kind of abnormal and is not representative of the normal pollution concentration relationship. And using this as a baseline, actually we end up getting exaggerated effectiveness of the pollution control. And what's worse is a study led by my colleague, Dr. Mijo, who is also in the audience, suggests that this, as climate continues to warm, and if India does not apply stringent aerosol pollution control, in the future, in the most polluted Indo-Gangetic plain in winter, there will be increase in stagnation days, which means the weather pattern will be more favorable to track pollution close to the surface, and that might result in 7 microgram per cubic meter increase in pollution level due to this climate change effect alone. And that might offset the future emission control benefits. So what we saw through that study is that India has made notable improvement in air quality, but we find through model simulation that part of this is due to weather changes and the choice of an extreme dry and stagnant baseline year. And the good news is that the policy has a recent update that have shifted their baseline year to 2019, which is a more representative baseline condition. Despite that, we saw 4 out of the 6 cities that meet the National Clean Air Program target. Even in last year, PM 2.5 levels in many Indian cities still remain above their national levels, above their national air quality standards, and not even to mention the WHO standard. This is linked to some lack of capacities that we find in India pollution control domain, where there is lack of monitoring data, there's no accurate emission inventories that's resulting in and probably inadequate knowledge for us to better manage air pollution. However, we do see that while our previous work focused on the national pollution improvement, there are huge inter-city differences in the pollution changes over the past few years, with Delhi showing about 20% reduction, but Varanasi showing about 70% reduction. These differences in pollution level reduction across the cities are very interesting, and we are trying to look at what local actions have been most effective, for example, in Varanasi, but not in Delhi. And in addition to this local action, because of the increasing emission that's possibly tied to the increasing economic development over India in the coming years, we also want to understand whether there is opportunity before its massive build-out of its energy structure to achieve air quality and climate co-benefits by better integrating national policy design into the pollution control framework. So the India and US story has both point to the growing challenges in managing air pollution under a changing climate. And these not only complicate our interpretation of policy effectiveness, but also potentially can worsen air quality in the future without a complete shift or changes in the regulatory framework. Where are we going to heading in the future? Are we going to see continual increase? By how much? Or we are able to bend down the curve to continue what we previously experienced? The continual improvement in air quality remains uncertain. But through all this work, we believe that the accessible and reliable data are one of the key things that we need to work on, which fuels scientific understanding and also empowers public awareness that drive policy action. Similar transformation occurred in Beijing. By the time when I graduated from Tsinghua, Beijing PM 2.5 level has reduced by 50%. And that's largely a result of the expansion of the city itself, air quality monitoring network, but also nationwide. In addition, public engagement and awareness is the most important part driving this strong policy intervention. As one of my friends who has been taken, a normal Beijing citizen, has taken photos of the blue or hazy skies over the past 3 years, and we have collaborated to co-design a paper that we published on EST and featured as a cover article. There are more interesting stories about China's air pollution along its clean energy transition, and you will find Denise will have a talk this afternoon at 4:30 p.m. and which will share with you more stories on the synergy side. And so to keep the momentum of the improvement, we think that having data public access and to improve engagement will be essential. So over the past summer, we've worked with 2 summer interns, Thomas and Hassan, who are also in the audience, to develop this interface project that include interactive maps, charts, click options, and multi-layer timescale analysis that not only provide you with an easy access to the data, but also create a type of visualization and a flexibility of the options that you can explore the data that you care. If I have time, I would love to show you later this website. And this is the changes in surface temperature over the past century. We had refreshing surface temperature records year by year. And while the dangers of global warming hang ominously over the planet, there is something discouraging that happened as early this year, the US Embassy air pollution monitoring data has become available, which has been a very important source for us to validate the India air pollution monitoring network. While we all navigate these challenges or uncertainties, I'm still very proud and happy to be part of this team and this nice community to continue to contribute to improvement in air quality and public health. And with that, I would love to acknowledge my collaborator across the world and the summer interns who work with me that are really amazing in contributing to the research and the interface project. And also my funding support from C-PREE, CGI, SIMS, and HMEI. Thank you so much. Do we have time to? Sure. So I'm very excited to first share with you the wildfire project interface that we developed over the past summer. And you can see there are different options tab here where you can look at total smoke or non-smoke pollution. And you can select what year you like to look at, for instance, 2023. And if you want to look at the most polluted months in June, where we are affected by the Canadian fire, and zoom into where we are. These are the daily concentration, as we just showed, that reach hazardous level in these days. And in this month, this chart shows you that smoke, in fact, contribute to over 70% of the pollution level in that month. We also have this functionality where you can check whether the exceedance of air quality is due to fires or not due to fires across the US counties under the current standard of 9 microgram per cubic meter, as I've just showed you on the map, and also under a potentially more stringent threshold. And when you hover over different counties, you will be able to see their values for both the exceedance categories as well as the pollution concentration. And this is our web interface for the India project, where we can navigate PM 2.5, PM10 pollution and understand what are the major source contribution to the PM 2.5 pollution. And these dots represent city level pollution. Either you can display in an annual mode or look at specific season, for instance, winter, the most polluted ones. And if you hover over a specific cities, for example, Lucknow, it gives you the time series of how this seasonal pollution has changed over the past several years, and whether different stations show different levels of pollution or consistent trends of pollution, and where are those stations, why we see some of them are higher, some of them have lower pollution levels. In addition to annual and seasonal, we can also plot the distribution of daily pollution level and comparing how that has changed over the past several years. In addition, we have this very cool data download functionality that allows you to specify what data you're interested in, and you can download by a click. In terms of what is contributing to PM 2.5 pollution, this source apportionment map gives you an idea of what is the contribution from the power sector and what is the contribution of other industry, residential, different sectors. For instance, if we want to understand the percentage contribution over this, and we can see the power contribution to total PM 2.5 is about 10%. While residential is a more important contributor in the Indo-Gangetic Plain. And this is just the start of the interface project. We are looking forward. We are planning to integrate more studies into the web phase, including our health analysis, as well as some policy analysis that try to provide, no matter it's policymaker or general public, a holistic understanding of the problem. And hopefully this will contribute to raise the awareness and facilitate a more strong and effective policy intervention to address these challenges.
Thank you for that excellent overview of your super interesting work. The floor is open for questions. I think you can take your questions yourself.
Hi, very excellent eye-opening work. I was wondering if you have analyzed this time of the year, when the monsoon ends in India, and the direction of the winds kind of reverses, and whether that particular time, along with the burning of the rice crop that happens in Punjab, that have you analyzed that in more depth? Has that revealed anything specific in kind of key insights about, because weather has a big role to play in India, as you said, that the days of high precipitation are obviously better compared in terms of air quality. So actually, this time of the year is probably when it takes a turn for the worse. Yep. The monsoon ends, it starts getting worse, and by January it becomes really bad. So this transition that happens has any kind of analysis repeats?
Yeah, that's a great point. So in our work, we've analyzed both annual and seasonal changes with specific focus on winter. We, through our seasonal analysis, we understand that post-monsoon is also one of the most polluted season. It's more. Oh.
You can see what you answered the question with the map. So yes, we have analyzed different seasons and all the data monitoring stations and the source contributions.
Yeah, with regard to a question of specific weather pattern in post-monsoon, we haven't looked specifically at those periods. But there is an ongoing work that tries to examine the changes in western disturbances, which is one of the major winter storms that start from probably post-monsoon that ends in March. And we're trying to understand how differences in western disturbances affect pollution variation year by year. But in the post-monsoon season, there are other compounding effects, including the crop residue burning that you mentioned, as well as sometimes the Diwali. Yeah, that's causing pollution extremes.
These are all very political and very sensitive issues in India. It's very hard to discuss that.
question about the mitigating strategies. So I think there are air push increase from wildfire in recent years. I'm wondering, so if we are going to mitigate this air pushing, I think there are really two ways. First, we can further mitigate the emission from industry or the conventional sectors. Second, we can reduce the emission from wildfire. So I'm wondering, so which one do you think the most cost-effective way to mitigate the air pollution?
I like this question, but I don't have an answer in terms of cost effectiveness. But we think that in response to this increasing wildfire, both are needed. And if I can go back to this interface, where if you look at the contribution of exceedance at a slightly more stringent level of 8, actually anthropogenic emission was still the main driver of air quality exceedance, which means that continual reduction in anthropogenic emission is possible and could potentially bring huge benefits to air quality. Especially the increasing, in the context of this increasing wildfire, doing both will be necessary.
Any other questions?
Thanks for your great presentation. You talk a lot about outdoor air pollution and the measuring network. So I studied indoor environment in my undergraduate, and one sentence that we usually write in our paper is people spend 90% of their time indoors, in indoor environment. So I'm just curious, when you talk about mortality, can you attribute mortality to indoor pollution exposure and outdoor exposure? Or like during wildfire, we can stay at our home. Do you think we have any adaptation to make use of indoor environment or any filtering technology to address this challenge?
I think the point that you raise is actually one of the things about wildfire pollution exposure is the behavioral changes, like people can choose to leave the places for a while and then come back, or like what you said, stay at home with air filter on to reduce pollution level. So this actually is linked to the question of who are able to adapt. Not everyone are able to adapt to this. And for mortality analysis, we are adopting the data from outdoor monitoring station and the globally cohort study of that link outdoor pollution concentration with mortality. And so we think that's a robust estimate of the pollution, the mortality level attributed to exposure to outdoor pollution level. And so what you mentioned is an interesting point that we might think of, because wildfire pollution exposure might be different from anthropogenic sources, which are year-round. For wildfire, it could be episodic, but in some regions, it could also be months-long. And how people adapt to it, how people are able to adapt to it, are interesting questions for us to look at.
Okay, if there's no further questions, let's thank Dr. Xie again.
Thank you.